This is TTT Live. I'm DK Rasta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We now go to Senior Corporate Communications Officer at the Ministry of Health, Al Alexander.
Good morning, Trinidad and Tobago, and welcome to the Ministry of Health's virtual media conference on the national COVID-19 response for Wednesday, 21st July 2021. I am pleased to welcome back today's panel, Dr. Roshan Parashram, Chief Medical Officer, Dr. Avery Hines, Technical Director, Epidemiology, and Ms. Lizana Guerra, Chief Financial Officer, Lanson Roach Industries. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health. We begin with Dr. Parashram, who will present the clinical and vaccination updates. Dr. Parashram.
Hi, good morning. Thanks, Mr. Alexander. Good morning to Dr. Hines. Good morning to Ms. Roach, Guerra, from who will be giving a testimonial in terms of vaccination, her personal vaccination story. We begin this morning with, as usual, with the COVID-19 update as of 20th of July 2021. So the total figures as it relates to testing now stand at 255,325. Of those, over the last 24 hours, we would have reported 156 new cases, taking our total positive cases to 36,354. Our total recovered patients now stand at 29,663, with a total active caseload at 5,691. Those at home isolation, 5,150. Those in hospital, 301. Total patients in step-down, 84. And total patients in state quarantine facility at 146. We now stand at 1,000 deaths, and condolences go out to the families of those persons who would have lost loved ones during the time of the pandemic in the world and in Trinidad and Tobago. Yesterday also marked a milestone of 4 million deaths in the world as of WHO's bulletin. In terms of our total persons vaccinated with first dose, 262,976, and those fully vaccinated second dose, 174,992. If I could have my first slide of the cases. So we're going into some community cases, so telling you, as usual, which ones are hospitalized, where they are in terms of jurisdiction. So starting on the upper left, we look at the percentage of those active cases in the community. In Tobago, 2%. St. George West, 12.4%. St. George Central, 15.7%. St. George East, 9.6%. St. Andrew St. David, 4.7%. County Caroni, 17.6%. Neriva Mayaro at 1.4%. St. Patrick, 12%. And Victoria, the most affected county in terms of active cases, 25.3% at this point in time. Next slide. So in terms of our clinical case disposition of home isolated patients, 4.7% represent recovered individuals, transferred to facilities 3.2%, symptomatic 45.8%, and asymptomatic 46.3%. Next slide. Comorbidities, again broken down. We see that diabetes and hypertension continue to be, and that way throughout the epidemic, be the most common comorbidities seen in our population of COVID positives. Diabetes now standing at 30.4%, hypertension 31.9%, followed by asthma, which is at 17.9%. Immunodeficiency very low, 0.1%, heart disease 2.2%, and other comorbidities at 15.2%. Pregnancy, as we have said, is not a comorbidity, but it does put you at a slight increased risk of complications of COVID. So we have it captured here at 2.1% of all active cases at this point. Next slide. Percentage with comorbidities from home isolated, those without 58.9%, those with 41.1%. Next slide will show you the age distribution of the infected individuals. And starting on the left-hand side, we look at 0 to 19 years of age at only 5.05%, 20 to 39, 28.06%, 40 to 59 at 31.66%, 60 to 79, 19.10%, and 80 plus, 16.14%. that 80 plus category is slightly increased from the earlier epidemics of phase 2 and phase 1. We see the bulk of the infections, however, still being within that 20 to 60 age group throughout the epidemic in Trinidad and Tobago. Last slide. So last slide just gives you a breakdown of male to female in the community, and again, it's almost half and half, 48% male and 52% female. So, Mr. Alexander, that brings me to the end of my presentation for this morning.
Thank you, CMO. We now go to Dr. Hines, who will present the latest COVID-19 epidemiological update. Dr. Hines.
Thank you, Mr. Alexander. Good morning to my colleague, Dr. Parasram, to my colleague, Ms. Guerra, and good morning to members of the media, members of the viewing and listening public. If we may have the first slide, we're going to go straight into the epidemiologic update. Looking at the data that we've collected thus far as at the 20th of July 2021, next slide please, what we see is the epidemic curve that we've been describing for the past year are now doing something slightly different. It's beginning to flatten out. If you look at the heights of those purple bars, not purple, rather the fuchsia bars representing July, you see that they're sort of maintaining the same kind of height overall for the past couple of weeks. You're seeing the heights of those bars not continuing to get shorter and shorter as we move from right to left. So that's one of the indications that we describe as a plateau, meaning it's a flattened area as opposed to a continued downward slope. So this is a trend that we are keeping an eye on as the data continues to accumulate. Let's move to the next slide. Looking at this same data again on a weekly time scale as opposed to the day by day, we see a similar thing where the weeks 25, 26, 27, 28, first you see 25 to 26 showing that continuing decrease that we had from the middle of May or so, where every week the bar is a little shorter, but then 26 and 27 are approximately the same height, 27 and 28, again, approximately the same height. In fact, there's a very slight increase from one week to the next, 1% in 1 week, nearly 6% in the next week. So we're looking at that again. That's the same sort of plateau that we're speaking about, the same flattening out instead of continuing that downward trend that we've been seeing manifesting since the middle of May. So it is a trend that we're keeping an eye on. On the brighter side, however, we do note that the positivity, that's the number of positives coming back for every 100 COVID tests that we do, that has dropped to about 25% in this current week of week 29. And again, this is just an indication of overall levels of circulating virus, because the lower this is, it reflects that there may be less virus circulating at this point in time, fewer people coming in with illness that is actually COVID related. Next slide, please. Same data, this time on a monthly time scale, and we see that overall, if you go from 1 month to the next, we have been seeing that downward trend, which we expect to continue to the end of July. So May had the highest totals for the entire time period, followed by June, but those totals are less than May, and we expect that the totals for July would also be less than those for June. So we expect that downward trend to continue, and we do see that that background showing the positivity again for all of July hovers around 26-27%. Next slide, please. Looking at this now, we're looking at the accumulated data on age and sex for basically a 1 year period here, from July 20th last year to July 20th this year, spanning the period of what we determined to be community spread. And what we've seen is that this pattern, the shape of this graphic has remained pretty much the same throughout, where the majority of individuals are in that 25 to 49-year-old age group. Those above 60, we have noted that has climbed over the past several weeks, a little by little. It was below 15%, and it has gotten all the way up to about 16.6%. And again, noting that this is the age group that's most affected by the virus and most likely to have adverse outcomes, even a small percentage change here is something of interest and of significance that we need to keep an eye on. Now, we're looking at the age-sex distribution. The sex distribution is about 50-50, as the CMO had pointed out. Next slide, please. and looking at the COVID-19 fatalities, we do see that, again, that male to female ratio, which at one time was 3-1, has now come down to basically a little under 60-40, it's 59-41 at this point in time. And that trend has been manifesting itself since about May. In the height of the epidemic, we noticed that the male to female ratio began to swing away from predominantly male towards a more even balance. What we also did notice is that over that time frame, we also started to see an increase in the proportion of the deaths accounted for by people over 80. And this, again, because of the age group and the likelihood of pre-existing comorbidities, the rate of fatalities in that age group is higher. So we're noting that more people in the age group are affected, and therefore they are contributing a larger proportion of those among the fatalities. And for now, that's the end of the epidemiological update. I'll turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. Today, we are pleased to welcome Ms. Lizana Guerra, the Chief Financial Officer at Langston Roach Industries, as she shares a personal testimony on why she found it important to get vaccinated. Ms. Guerra.
Thank you all. Dr. Parasram, Dr. Hines, to the members of the media and the viewing and listening public, good morning. My name is Lizandra Guerra, and I've been living with asthma for most of my adult life. During this COVID period, I have found ways to reduce the risk of getting an attack. These include knowing the triggers as well as taking the recommended supplements and vitamins to maintain or boost my immune system. Now, there was so much uncertainty surrounding the COVID-19 virus at the beginning. And being an asthmatic, I must admit that I was a bit paranoid and a little fearful for my life, especially since my job required me to be at the office every day. Not only was I concerned for myself, but for my family, including my 2 boys and other close relatives. To protect myself, I did a lot of research about the COVID-19 virus and its symptoms, doubled up on vitamin C, and consistently tried to follow the 3 Ws. Then there was news about the vaccine, and I was elated when they started arriving in TNT. I also started doing additional research, and this is what I concluded about the benefits of vaccination. Vaccines lower the risk of contracting the virus, or worse, having a severe asthma attack because of infection. Vaccines protect those closest to me, my children, mother, and work colleagues. And should I get infected with the virus, vaccines increase my chances of recovery. Armed with this information, I did not hesitate to get the COVID-19 vaccine when given the opportunity. I confirmed with my doctor that I could take the vaccine, and now I am fully vaccinated, having received the 2nd dose of the AstraZeneca vaccine on July 7th. I really want to commend the administrative nurses at the Taquariga Racket facility, who were friendly, gentle, and very professional. After my first dose, I experienced a bit of fatigue and chills, which are absolutely normal after the vaccine. Fortunately, I had no side effects after my 2nd dose. Having received my full vaccine, I feel I have made a very important decision to protect my family and those I care for and love. Now, being vaccinated does not mean that I let my guard down. I continue to follow the 3 Ws, wear my mask, wash my hands, and of course, watch my distance. But I appreciate the significance of vaccines in this fight to save both lives and livelihoods. Vaccines protect our lives and will support bringing back some sort of normalcy, which will positively impact our livelihood. I also fully support the government's initiative, Vaccinate to Operate, as a means of returning to some sort of normalcy for our children to return to school and families to put food on their tables. I really believe that we must start to learn to live with COVID and not be fearful of the virus. Vaccines give us a fighting chance to beat the pandemic and get back some semblance of our lives. We must all be a part of the solution. I challenge you that if you are in doubt about the COVID-19 vaccines, obtain information from reliable sources and check your doctor so that you can make an informed decision. Let's all make a difference and vaccinate TNT. Thank you.
We thank Ms. Guerra for sharing her experience with us, and we do hope that her testimony encourages all those who are still deliberating to be vaccinating. For lives and livelihood, let's vaccinate TNT. As we move into the question and answer segment of this conference, we ask our media representatives to indicate their name and the name of the media house that they represent before posing their two brief questions. Kindly identify the presenter to whom you will be posing your questions. And of course, if time permits, we will field an additional question from each media representatives. We now go to Power 102.
Good morning, Sparkle McIntosh, Power 102 Digital.
Morning.
My first question is directed at Dr. Hines. Dr. Hines, has the ministry continued testing for the Brazilian variant of COVID-19? I know that as of lately, there has been much talk around the Delta variant. I know that it has been affirmed that it's not presently in the country, but what about strains that had already been here, such as the Brazilian variant? And if the ministry has in fact been constantly testing for it, what is the prevalence of it in this country? And if not, why so?
Thank you.
Okay. So yes, as you know, the Caribbean Public Health Agency continues to test for variants of concern as well as for any variants of interest in particular. So basically what they're doing is genetic sequencing of the samples. The samples, as we said before, from Trinidad and Tobago and other Caribbean countries are sent across to the Trinidad Public Health Lab from our side, then to the Caribbean Public Health Agency, and then the University of the West Indies. So UWI are the ones that are performing the test under Professor Carrington, who has been here multiple times. And basically what we are finding is, of course, the P1 variant seems to be the most dominant variant in the country at this point in time that we are picking up, which is the Brazilian variant. So again, the other variants that have showed up before are the B117, which is the UK variant, and the P1 variant. That's the variants of concern. We haven't picked up to this point or confirmed any of the Delta variants or any of the South African variant.
Thank you, CMO. We now move to AZP News. Good morning.
Good morning. Prior Harry, azpnews.com. My first question, I wanted to find out, Trinidad and Tobago has one of the highest death rates due to COVID-19 in the world. Has the ministry done an assessment to find out why is this so? Are we treating our patients in ICU differently, or what are some of the factors that has led to Trinidad and Tobago having one of the highest, if not the highest, death rate of COVID-19 in the world? That's my first question, and I would like to ask my second question after I get a response to this, please. Thank you.
No, please ask.
If you could ask the second one, please.
Yes.
My second question will be based on the answer I get, you see. I don't know what the second question is at this point.
Okay, so we'll come back to you for your second question.
So as of this morning prior, and just for the listening and public and the viewing public, Trinidad and Tobago does not have the highest death rate in terms of case fatality rate in the world. It spans all the way from countries that have very low death rate, 0.1%, all the way up to 14, 15 and beyond. There are some countries that have death rates in the 20s. Again, and we discussed this at the Prime Minister's conference on Saturday, it depends on the people that are being infected. We look at the profile that we have in Trinidad and Tobago in terms of the epidemiological profile of the people that are being infected. We have a very high prevalence rate of diabetes. Dr. Hines has said that we have seen a large proportion of the people over 60 being infected. 85% of our deaths have occurred in people over the age of 50. Those under 50 that have succumbed to the illness have also been, to the most part, with a few exceptions, had comorbidities of some type, diabetes, asthma, or some other illness. So it depends on who is being infected. Trinidad would have had a death rate of about 1.7 in phase 2 and continuing into the early parts of phase 3. In the recent past, it has gone up to 2.75, which is similar to the UK, similar to other countries around the world. It matters who is infected. So if the 33,000 people that were infected so far belong to a group of people 20 to 40 years of age without comorbidities, our death rate would have been much lower. So we have been saying from day one that we need to protect the vulnerable population our vaccination campaign had launched with phase 1, which are the vulnerable people, those with comorbidities, those over 60 with comorbidities as well. And we are trying all of this to protect the vulnerable ones so that we give them the best chance of survival. And we're asking everyone who belongs to these populations to continue to be vaccinated as the only and the main way, public health way, to protect yourself and your loved ones.
Thank you, CMO. We now move to IETV. Good morning.
Hi, good morning. Binami here, IETV News. I have two quick questions. I'm not sure if Dr. Hines or Dr. Parasram will be able to assist. So a member of the public would have contacted us 2 days ago with a question. They said if a person received their first dose of the AstraZeneca, and before their second shot, they tested positive for the COVID-19 virus, what's the procedure for them to get their second shot? How long do they have to wait? Because so far they have not been contacted by anyone.
Okay, sure.
And my second question, can we have an update in the number of deaths outside of the hospital setting as it pertains to COVID-19? Thank you.
Okay, for the first question, in terms of your person has the first dose of AstraZeneca, they contracted COVID thereafter. You wait 3 months from the date of the positive test, and then you can have your second dose at that point in time. The same thing holds for both AstraZeneca and Sinopharm. Just for clarity, if you hadn't had any doses at all, and you have COVID-19, you again wait 3 months from the date of confirmation. In all cases, just bearing in mind that what we are trying to achieve is that you are free of COVID-19 itself in terms of the acute phase and the complications of the same. So if you have persistent symptoms that are going into that period, it will augur well for you to get your clinicians go ahead before you have your vaccine, but the national policy stands at 3 months from the time of your confirmation of your positive test.
Okay, with respect to your second question, the proportion remains around that 7% or so that we had noted earlier on when we did that update. It hasn't really increased or changed. And as we continue to do the update, we will bring another more specific category by category table or tabulation into the public domain once we have all the outstanding information, because some of the information is still outstanding. Once we have all of that compiled and collated, we will do another update as we have done in the past. So thank you for asking.
Thank you very much. We now go to 103.1 FM for your two questions.
Good morning, everyone. Sarah Chandu from 103 FM. Both my questions are directed to the Chief Medical Officer. First of all, the various ministers, the government has previously said that the guidelines being used for various measures, restrictions, and so on are guided by health officials. So in this vein, I would like to ask, there have been questions raised recently about the requirements regarding entry into TNT that stipulates PCR tests for minors.
Mm-hmm.
There are 2 tests required within the space of a week, and minors are defined as any person under the age of 18 years old. Now, there have been some concerns about this applying to very young children or babies. So can the CMO, first of all, weigh in on the matter of PCR testing for this particular age group? And secondly, the ministry earlier this month authorized the use of IL-6 receptor blockers for COVID patients. How many have so far been administered this particular treatment, and how helpful was it? Thank you.
Okay, sure. All right. So in terms of minors, the policy of the entry policy as it relates to PCR testing in Trinidad and Tobago since the beginning of the pandemic has been the same, meaning that since we've started to do PCR testing 72 hours prior to entry, there has been no lower limit for that testing to be cut off, meaning that it has started at birth and gone all the way up. In terms of our policy, it remained the same with the opening of the borders, and we actually added in for that category, which is children, another test between days 3 and 5 upon entry into the country. The reason being those persons in general can't be vaccinated, and they pose a greater risk. Also, in terms of our mask wearing legislation, as you know, children under 8 are not required to wear masks. So they do pose a greater risk of being infected and transmitting possible variants or other forms of the virus as they come in, and we are seeing it as an essential step to ensure that they do have the PCR both before entering and at day 3 and 5 to give us that additional assurance that if they do become positive, that we are able to pick it up, isolate those persons from the rest of the population as quickly as we can. So there has never been, since the beginning of PCR, a lower limit in Trinidad and Tobago, and that continues to be the policy at this time. And just to let you know as well, we have picked up children as early as 2 months who have required ICU admission in Trinidad and Tobago. And, anyone, regardless of age, can have COVID and can develop complications of the same. So in terms of your second question, just remind me quickly of your second question. Hello? Yes, you got the second question.
No, I didn't.
Yeah,
yes,
just remind us quickly of your second question.
Yes, the IL-6 receptor blockers were approved for COVID patients.
Right, yes. So I heard Dr. Trotman indicate at the last time that she did use it on one patient shortly after approval, so I can get that update from the clinicians at all the institutions that treat COVID-19, and then we can give you that at a later date.
Thank you very much, CMO. We now move to TV6 for your questions. Good morning. All right. Good morning. We are not hearing you at the moment.
Are you hearing me now?
Yes, we are. Good morning.
Hi, good morning. Alicia Boucher from TV6 here. My first question, Dr. Parasram, we're seeing what's happening internationally where studies are now concluding that the Johnson & Johnson vaccine is not as effective against the Delta variant of the virus. Now, given that we are expecting a shipment from the African Union, medical experts are saying that, you should boost it with a shot of Pfizer or a shot of Moderna. WHO has not approved Moderna as yet, and we don't have Pfizer in the country at this time. So I was wondering, in this regard, how is the ministry advising the government on this acquisition? That's my first question. And my second question is, I wanted to find out whether or not, do we have data in terms of how many non-nationals have had COVID-19 in Trinidad, and whether among the death toll, whether there are non-nationals among that number. Thank you.
Okay, so just to clarify one point, Moderna is of WHO approved. So you said Moderna is not WHO approved. Moderna is WHO approved. The efficacy of vaccines changes based on the circumstance, right? Johnson & Johnson, as it stood, had a very good efficacy when you had compared it to the new lineage. The research that is ongoing will continue to test its efficacy in a real-world environment against Delta and other variants. However, all things being equal, most of the vaccines that have been produced produce an effect that is substantial enough to prevent hospitalizations and deaths, regardless of the variant of concern. We have seen some that will have better responses to different variants. As you know, some countries, for example in the UK, they have all 4 variants. You can see in a real-world setting what is the efficacy of one vaccine opposed to the next. Johnson & Johnson continues to be a very good vaccine, and more so for the reason that it is a single-dose vaccine at this point in time. It gives us the added benefit that it can be vaccinate a large group of people very quickly, and 2 weeks after your dose you get the level of immunity that at least it purports at the outset from its clinical trials. So it is a very good tool to have so that we can get vaccination rates in the country up very quickly, as it's a single dose, and we will stand by WHO's decisions to whether to continue with their emergency use authorization and emergency use listing for Johnson & Johnson in that regard. Dr. Hines, I believe, will answer your second question.
Okay, this question recurs from time to time, and each time the answer is given, it's the same. The number of individuals that have been diagnosed with COVID-19 was never really disaggregated by nationality for several reasons. One of them being nationality is not one of the things that's collected as a data field when the information on your lab request form is being taken down. Now, it also doesn't really matter for the simple reason that once there's a living, breathing human being on the landmass, then they contribute to both the risk and to the risk reduction by either acquiring the virus or by being vaccinated in the same manner. So it's not one of the fields that was really being calculated or tabulated to disaggregate the data by. There have been very small numbers of individuals who have been identified as non-nationals, but as it was not a field that was being regularly or rigorously collected, it's not something that we can give a statistic on. And no, I do not believe, but I could be wrong, I don't believe that any of the fatalities that we have noted were noted among non-nationals, or maybe they may have been, but again, as we said, we're counting everyone as human being living, breathing on landmass of Trinidad and Tobago.
Thank you very much, Dr. Hines. We now go to I-95.5 for the two questions.
Yes, good morning to you, Alan. Good morning to everyone else there with Field Turner I-95.5. Dr. Parishram, I would like to find out what recourse, if any, is there for persons who are relatives of someone who would have died from COVID-19, having contracted it on a medical facility, let's say a ward or so. And for Dr. Hines, you mentioned again in one of your slides the issue of the plateauing to the extreme right of that slide. What's the likelihood that this plateauing could actually lead to a new spike in cases, especially given the now reopened borders and other sectors of the economy being reopened?
Thank you for your questions.
So yes, I'm not, in terms of recourse for someone that has passed away at any of the institutions by way of families thinking that they are grieved in some way because of whether they contracted in the institution or for some other reason. There's a protocol which is followed. You can write to the regional health authority and of course you can seek other means by which you can have a medical report first of all, and then of course write to the CEO of that respective RHA to have further investigations done. So there's a process through the regional health authorities if someone is aggrieved in terms of death of their loved ones.
Thank you very much, Dr. Hines.
Okay, thank you for the second question. It is an excellent one. The plateauing means that the rate at which we're seeing decreases the numbers of cases, that rate has slowed. So the decrease has slowed and we're seeing relatively similar numbers of cases over a protracted period of time. Now this is as a result, in part, of the increased movement that we would have seen beginning with the bringing the construction sector back out, bringing everybody else back out, and the additional interaction that's happening in the population since we've begun this increased level of movement. So yes, there is of course a risk that there can be a turnaround instead of a plateau, and that there can be an increase in cases, but that risk is really modulated by the behavior of the population in two regards. Number one, in acquiring the vaccines made available to them, the more people get vaccinated, the more quickly we increase the proportion of vaccinated individuals in the population, the slower that potential increase may be, the lower the risk of a sharp increase because there will be fewer people who are susceptible. Additionally, with the increased movement, even whether or not vaccinated, the public health measures, the public health recommendations still stand. The 3 W's, wearing your mask, watching your distance, washing your hands, or asking, where is your mask? When last you wash your hands? Why are you so close to me? These are the things that are going to help us to reduce our individual risk as we interact, and these are extremely important. We brought the collection of food back out. We don't need to crowd in order to get the food. There's time. All of these things are the things that are going to determine whether or not we see a rapid change in the direction of this trend or not. So beyond the vaccine, the behavior of the population is really going to answer the question that you have asked.
Thank you very much for your questions, Mr. Turner. We now go to CNC3 for your two questions. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media. CMO, I just want to get an update on any expected future doses of COVID-19 vaccines, especially those from Mexico, the US, and the African Medicine Supply Platform. If you have any update for us, please, thanks.
One question? Okay.
Yeah, so more or less it stands as to what the Prime Minister would have given on Saturday gone. In terms of his update, there has been no change that I am aware of. But again, the Honourable Minister and Prime Minister will be the ones giving those kinds of updates.
Okay, thank you, CMO. We have time for a few questions. So we go to Power 102. Go back to Power 102 for a single question.
Sparkle McIntosh, Power 102 Digital again. My question is for CMO Parasram. Can you indicate the number of persons repatriated since Saturday's border reopening, as well as disaggregate vaccinated and non-vaccinated persons among that total?
No, I don't have that information with me right now, but I could tell you for the first flight, which I was aware, there were 40 persons on that flight, 4 of which were unvaccinated at that point in time. On the second flight, somewhere in the region of a small number again, similar number, and only 1 person unvaccinated. So for that first day, I was fully abreast of what was happening from Port Health. They continue to gather that data, and I can get that data set to you if you wish.
Thank you very much, CMO. We now go back to AZP for a follow-up question.
Hi, good morning again. I just wanted to follow up with my initial question in terms of the high death rate in Trinidad and Tobago of COVID-19. So is it that you are saying that because Trinidad and Tobago, we have a high incidence of NCDs, comorbidities, and many of the people who have contracted COVID-19 and passed away have had these NCDs, and that is maybe one of the factors that has caused so many people to have died? Thank you.
Yeah, so there are many factors that will contribute. One of them is, of course, if you have a population that has a higher degree of comorbidities as it starts, there's a higher proportion or higher chance of one of those people becoming infected. And of course, if a greater amount of those people with comorbidities become infected, then of course it means that there will be a greater amount of those people having complications, and of course possibly succumbing to the illness. Again, it depends on which proportions of the populations are being infected, and we have really pushed ahead and tried to protect the vulnerable as best as we can. And still now we are calling out to anyone that would have comorbidities. As you know, the RHAs have moved ahead, and they are asking anyone above 18 who are not pregnant, because, as you know, we haven't given the okay to give the vaccine to pregnant patients at this point. But anyone above 18, please visit your health centers or the mass vaccination sites to have your vaccination as quickly as you can, especially if you belong to any of the vulnerable groups.
Okay, just to tack on to that, CMO, if I may.
Sure.
Just because the statement is again being made about a high death rate, when I think we established that the death rate in Trinidad and Tobago is not spectacularly or unusually high. Again, looking at the global average in countries above and below that global average, you would note that the UK and Italy and Germany are also above the global average, and that is because there's a wide range of case fatality rates. And for example, as we mentioned on Saturday, with the age distribution of those being affected leaning towards some of the older and therefore more vulnerable individuals, a country like Italy had a case fatality rate of 2.99. Ours is 2.75 at present, and we were noting that trend that we had made a point about, that there were older individuals who were being infected, and therefore we also wanted to boost the call for those older and those vulnerable individuals to get themselves vaccinated. So I don't want the understanding to be that there is a higher than normal or higher than expected or a higher than acceptable case fatality rate. Every death is one that we try to avoid. Every outcome that is unfavorable, every outcome that is fatal is one that the health system has worked hard to avoid but was unable to do so. And the improvements in case fatality are going to be along the lines of reducing vulnerability and accessing care as early as possible. One of the ways of reducing vulnerability is the vaccine. So the takeaway is, especially among those older age groups and those more vulnerable, those with NCDs, please avail yourselves of the vaccine. So that is going to reduce the risk of serious illness and adverse outcome.
Thank you very much, Dr. Hines. We now go to Newsday for a follow-up question. Newsday, good day.
Can you hear me? Hello.
Yes, we can.
Good morning.
Okay, great. Good day, everybody. We'd like to know, can one now say that since May that COVID is the number one killer or number one cause of death in Trinidad and Tobago, just how we would have traditionally said, say, cardiovascular illness or diabetes? And number two question is,
Mr. Douglas,
yeah.
Sorry to disturb. We're taking just one question at the moment, and if we do have time, we will take a follow-up question. Thank you for your question.
Okay.
So thank you for that question. The short answer to the question, of course, is no. The number one killer has not actually changed with respect to NCDs, cardiovascular disease, etc., being responsible for the majority of the deaths that occurred on a given time frame. It has manifested itself as an acute change in the causes of death, and that in and of itself makes it important. But no, it does not fall into the number one spot by any stretch of the imagination, neither locally nor globally.
Thank you very much, Dr. Hines. We go back to I-95 for a follow-up question. I-95.5.
Yes, thank you very much again. CMO, if you can give us an update, if we have it, on the situation with variants. Are we seeing a propensity one way or the other? For instance, we're seeing more males coming down with the variants as opposed to females, or vice versa, if you have that data?
No, when I get the data from the university, it's not disaggregated by age. Sorry. When I get the data from the University of Western East, generally it's not disaggregated by age or sex. It actually comes as blinded data because it's part of a trial, so it comes with a code on it. When I get it, I send it back to the Trinidad and Public Health Lab, and then they actually go back to the notes to get the data as is reported on the sheet from the physicians. So I don't have that disaggregated data. Generally, what is reported is the total number of P1 out of a given sample, total number of the previous lineages. So that's what I have at this time. So we can again look into it and see if it is predominantly one type of patient than the next. But generally speaking, our sampling strategy has remained the same, looking for it in areas that we expect to find it, where we have changes in the patterns of the clinical presentation in terms of migrant population, persons coming in through the borders, or those unusual sort of deaths in terms of ages and lack of comorbidities. So I can get further details if you like.
Thank you, CMO. AZP News, we are ready for your follow-up question.
Hi, good morning again, Prior AZP News. There is a study coming out of the UK that says that the AstraZeneca vaccine that is produced in India, the COVID shield, it gives you protection for life against COVID-19. Is the ministry aware of this? And I want to ask this too in the context of people who have gotten their second dose and are fully vaccinated. Do we have to wait a year again or 9 months for us to get another dose? What is the whole policy with that?
So yes, so thank you, Prior, for raising that. It's an interesting study that has recently come to light. And it's very good news for the people in Trinidad and the other parts of the world that have utilized AstraZeneca. Initially, when vaccines were being utilized and manufactured, people were saying that we would get 8 months to a year at best in terms of immunity. The study seems to suggest that you will get lifelong immunity from AstraZeneca. Again, it's early days and things can change depending on what types of variants come along. So I wouldn't want to cast that in stone, but it is a very good study to take note of, and it really supports the use of AstraZeneca. And AstraZeneca as well also decreases the risk of transmission of disease, one of the few vaccines that does that. There's a new study for Sinopharm as it relates to Sinopharm that came out as well when we're talking about studies as it relates to vaccines. And it suggests that it gives very good protection against the Delta variant, a study coming out of Sri Lanka. And it's again very good news for the country because we have a large quantity of Sinopharm in Trinidad and Tobago for use. And we have used AstraZeneca. So very good news by the way of research for both AstraZeneca and Sinopharm. I would say that the second study, it's very new. It's out of Sri Lanka. It has not been peer reviewed. So I would not say that we wholeheartedly, it is a good sign, but it needs to be peer reviewed before that data can be shared in its entirety.
Thank you for your question, Prior. We now go to TV6 for a follow-up question.
Okay, hi, Alicia Boucher from TV6 again. CMO, I know we were disaggregating data in terms of COVID-19 deaths using around 300, just over 300 cases of persons who would have succumbed to the virus to see whether or not they were vaccinated, fully vaccinated, and or whether or not they had had one shot of the vaccine. I was wondering if we could get an update on that to see whether any of those deaths whether those persons did in fact receive at least one shot of the vaccine.
So I think there's a little misinformation as it relates to the deaths. When it was first presented, what was said is that we began to look at we took data from June going forward, the 1st of June, and the number of deaths were in the 300s, and that was reported as having 300 vaccine-related deaths, which is wrong. So basically, what was reported at that time was that there were 13, at the first instance, there were 13 deaths in persons who would have had one or both doses of a vaccine in Trinidad and Tobago. The lion's share of it, I think it was 11 of those, would have had one dose. The persons that would have had two doses actually contracted the virus, one person just before the second dose, from the way we calculated, and one person just after. So no one had reached that fully vaccinated milestone of having two doses and being 14 days afterwards, and of course succumbing. So no fully vaccinated person has succumbed to COVID-19 as a death in Trinidad and Tobago as yet. And that seems to be the worldwide trend, that you're seeing that the majority of deaths are occurring in unvaccinated people and continue to do so. And again, it's very good news in terms of the vaccination programs that are going on, because it gives you that level of protection and confidence in the vaccines that it will prevent death and it will prevent severe disease, thereby decreasing hospitalization.
Thank you, CMO. Our final question comes from the Newsday. Mr. Douglas.
Hello, sir. Thank you. We were wondering, there was, when there might be a formal listing of all the details of the 1,000 deaths, the background, such as the demographics, any comorbidities, and the crucial thing as to whether persons died with COVID-19 or whether they died from COVID-19. Thank you.
Okay, I'll ask Dr. Hines to answer that one.
Okay, so thank you. As we actually mentioned earlier in this particular media conference, we have done that update in the past, and we will, once there is some outstanding information on some of those fatalities that we need to make sure we have in the database before we can generate the percentages and the sorts of things that we have done on at least 2 occasions so far. And we did say that once that information is available and we tabulate it, that we will provide that updated table. So once that information becomes available to us, that updated table will be published on the website as it has been done in the past. With respect to the second question, our local mechanism and the standard for counting the deaths is individuals with a COVID-19 positive laboratory test at the time of death. So that will include both people with and from, to answer your question.
Thank you, everyone. We have come to the end of today's virtual media conference. Remember, the COVID-19 vaccines distributed by the Ministry of Health are all WHO approved, safe, effective, and free. Be sure to take the COVID-19 vaccine when it becomes available to you, so that we can all get back to doing those things we need to do with the people we love. After vaccination, remember to practice the 3 W's properly. Watch your distance, wash your hands often, and wear a mask. For a healthy you and a healthy me, let's all do our part. Let's vaccinate TNT. Goodbye.